talking about keeping Tennesseans healthy by preventing so many diseases that are preventable, obviously, in the first place. And Healthy Tennessee, they're going to be talking about their mission. Dr. Manny Sethi is here. So good to have you here.
Yeah, well, thank you so much.
And Dr. Joel Bradley, who's been here before with UnitedHealthcare. Glad you came back to see us,
Yeah,
to sit on the red
back.
couch
Yeah,
and be with us
you.
again. All right, let's start with you, Dr. Sethi, and tell us what your mission is with Healthy Tennessee, what you're all about.
Sure. Well, thank you so much for having me.
Of course.
And Dr. Bradley, thank you. You know, at Healthy Tennessee, we started about 7 years ago, and our mission is really to improve the lives of Tennesseans through preventative care. We really do that in 3 ways: through online education, through statewide symposiums where we bring together big businesses in the community and together with different universities. And then the main thing that we do that I'm really the most proud of is these health fairs or screening events where we go into different communities all across Tennessee, rural towns, big cities, and we educate folks about the benefits of a healthy lifestyle using their own numbers. So for example, if you came into one of our health fairs, you know, you'd see local nurses and doctors who are all from the local community volunteering, and they would really spend time with you looking at your own blood pressure, your heart rate, your labs that we can do, but talking to you about how you can improve your life through lifestyle modification, through diet, through exercise. And so, because I really think that that's really important in Tennessee and we're not doing enough of that. And so that's what we're all about. How
do you reach these people?
So, you know, we do it in different ways everywhere we go. A lot of it is, you know, for example, is social media. We have an active social media education platform. And then a lot of it is just, you know, through word of mouth. So before we go to a place, so for example, Lawrenceburg, where we're going on October 21st at the Mars Hill Baptist Church, you know, we spend 2 months on the ground meeting local community leaders, advertising in the papers, you know, advertising on the radio. But I think really the main point is that you have to engage local communities. And if you don't do that, well, then they're not going to get involved. And so, you know, we're like a boots on the ground organization from the bottom to the top. And when we go into a community, we really try to reach as many people as we can in so many different ways.
And now we need to bring in Dr. Bradley to talk about how you partner with Healthy Tennessee to do the very work that he's just been discussing.
Sure. So Amy, the mission of UnitedHealthcare is to help people lead healthier lives. And we're very privileged to ensure about 500,000 Tennesseans, some of whom are very, very unhealthy, but many of whom are healthy or have unidentified risk. So when you look at our mission and our need to deliver it to these people, better health care, you can see why we partner with great organizations whose missions align with ours, like Dr. Sethi's and like Second Harvest Food Bank.
How do the food bank partners and the mobile pantries, how do they tie into these particular events? Either one of you.
So, you know, I think that what we're doing right now, this partnership with the mobile pantry, is something that is really powerful. So what we do is we go into a local community, and we've done probably close to 10 of these events now across Tennessee where we partner with a food bank. But it brings out you know, folks who otherwise they would probably never come out for these screenings, you know, and it's a great time to educate about healthy eating and about, you know, getting a screening done. But we're able to reach a group of folks who we otherwise could never reach. And, you know, we're very blessed as an organization to have this partnership with United. You know, Dr. Bradley and so many of his colleagues, when we were just starting out 7 years ago, really believed in us. And I think over time, you know, we've been able to do some of these innovative events like the one we're doing here with Second Harvest because of their support. And I think that we need to do more of sort of these community-based events across Tennessee and really across the country if we really want to get on the front side of health instead of treating disease but promoting prevention.
So you really want to obviously make an impact on those numbers and bringing the numbers of heart attacks down and cases of diabetes, obesity, and that's where you really want to make inroads here, am I right?
Absolutely, absolutely. I mean, you think back to what your grandmother may have told you, that you are what you eat, you know, and
still true.
Food really, yeah, food really is medicine, and so we know that getting right healthy foods out into counties, into cities, places where we may find food deserts, lots of unhealthy folks and lots of folks at risk for unhealthy conditions is the right thing to do.
And a lot of these, again, the preventable things we're talking about, heart disease, diabetes, what else are we talking about? Some types of cancer.
Yeah.
And I think that, diabetes and obesity, are the biggest problem that lead to a whole host of other things. Like, for example, just today, in this day that we're talking, 4,000 people across the country will be diagnosed with type 2 diabetes, which is a problem that you can easily prevent with lifestyle modification, as Dr. Bradley was saying, with diet. And those problems are going to go on to cost our country so much and cost individuals so much. And I think for so long, we've been treating disease on the back end, waiting until it's too late and just providing medication. When what we should be doing is talking about getting on the front end of these problems. And with diet, with exercise, just some activity modification, with weight loss, you can really change the direction of your life and your health destiny, essentially, if you will just think about prevention. And I think we're not doing that as a country. And I think that United is so, they have a vision, and I think this is part of that they really are on the front side and want to do something. And that's so we're just very blessed to partner.
Who can come for the screenings? Do they have to be the uninsured, underinsured, or can anyone come?
We really have a community focus, and we know that by having an all-comer community focus, we're going to draw from a higher population, not only the ones we insure, but others. So this is for the communities. Okay.
And where can people find out more about this? Is there a website or a phone number?
Yes. So you can go to www.myhealthytennessee.com. We also have a Facebook page, Healthy Tennessee, where you can see the details for our next event. But it's October 21st from 10 to 1, Mars Hill Church in Lawrenceburg, Tennessee. We'll be there. Come see us.
There's all the information on the screen. Terrific. Dr. Sethi, Dr. Bradley, good to have you back. Nice to see you again. Hope to see you again in the future and continue the good work.
Well, thank you so much.
Always a pleasure.
Take care. Thank you. We'll be right back.